Hi, and welcome to this Onclive peer exchange entitled Updates in the Management of Graft versus Host Disease. I'm Dr. Corey Cutler from the Dana-Farber Cancer Institute and Harvard Medical School. Joining me today virtually are my colleagues, Dr. Joseph Anton, also from the Dana-Farber Cancer Institute, and Drs. Yibin Chen and Dr. Zach DePhillip, both of whom are from the Massachusetts General Hospital. Today, we're going to discuss a number of topics pertaining to the management of graft versus host disease, including practical information for community oncologists. So we'll get started on our first topic, which will be discussing referrals for transplantation. So I'm going to lead off by asking Dr. Anton if he could briefly review what are the main indications for transplant at our center, and then we'll discuss the same question at Mass General.
So allogeneic transplants are principally applied in patients with acute myeloid leukemia and myelodysplastic syndrome. There are at least a dozen other diseases that are incurable with conventional therapy that transplant is amenable to, although those would be the two #1 diagnoses.
Dr. Chen, do you want to elaborate a little bit on the rare diseases that we see and the reasons that a community oncologist might want to refer to a transplantation center?
Sure. I mean, certainly our center sees the same subset of diseases that you guys see at Dana-Farber. So the majority of our volume is made up of patients with AML and MDS. You know, I think the other diseases that we do see that you guys see as well include acute lymphoblastic leukemia, certain rare types of lymphomas. We still move to allogeneic transplant. And then there's the benign hematological non-malignant diseases such as aplastic anemia that are treated with allogeneic transplant. But, you know, there are also diseases that years ago we did take to allogeneic transplant that we thought played a major role. And because of the development of other therapies, we don't generally see them anymore for allogeneic transplant. And these include patients with CML or chronic myeloid leukemia, except in a small subset of patients, many patients with non-Hodgkin's lymphoma and multiple myeloma. These patients we rarely take to transplant at this point in time.
Thank you. So how important, Dr. DePhillip, is it that we actually see these patients who might be transplant candidates early on in their disease course? When should a patient be referred in?
Yeah, sure, Corey. So there are a number of important factors that play into the timing of a transplant referral. But in general, as you suggested, you know, having patients meet with the transplant team early in their disease course is typically beneficial for the patients, their family members, and the transplant team. So for the patients and their family members, the initial transplant consultation, it's an educational session where they can learn about what's involved with the transplant. They can learn why they might be considered a transplant candidate and what steps need to happen in order to determine if transplant is going to be the right course of action for them. For the transplant team, it allows us to review the patient's disease in more detail and to begin the process of identifying a potential donor. So when thinking about how long does it typically take from the time of the initial transplant to the actual transplant, it really depends on a few main factors. I think the first is how urgent the transplant is from the perspective of the disease treatment. So, you know, for patients with acute leukemia, we're typically on a shorter timeline, whereas patients with myelodysplastic syndrome or chronic leukemias, they may have longer courses of treatment prior to the transplant. It's also important to know what the disease status is, right? Is the disease in remission or at least in response and amenable to transplant at this time, or is more treatment needed before moving forward with the transplant? And finally, who is going to be the donor and what the availability of that donor is. So, you know, a transplant can be arranged in as little as 4 to 6 weeks, but often plays out over a longer period of time.